this panel. And actually what we're going to be talking about is digital media and health and wellness. And we're going to touch on communications, PR, television, and marketing from our broad array of panelists here.
We can talk about aggregation of bloggers and that kind of stuff.
I'm sure that in some of the comments that will.
Ownership of subscribers. Anybody?
No, not at that level. So then that allows you to better use your time.
Right.
Yeah.
Yeah.
That's why I was asked.
Absolutely, and we appreciate that.
No.
Do you care if I kick off?
That's fine.
Okay. I'm going to go ahead and get started. We have one person who's actually ran to get a laptop to be able to project her slides, but we're going to go ahead and get started. And so, as I mentioned, I'm Patrice Smith, and I'm a healthcare and PR communications consultant, and have spent about the past 20 years or so working in various aspects of healthcare, everything from health plans to pharmaceutical companies to health IT and device manufacturers and soon hospitals. And so I'm very passionate about this area and this topic, and I'm very glad to be here. We're going to look at communications and TV and PR and marketing through the lens of our fabulous panelists here and the wonderful work that they're doing. And I'm going to introduce them in a few minutes. But I wanted to kind of set the stage for our conversation today. I want to talk a little bit about the changing healthcare landscape and the move to consumerism. Healthcare is undergoing just seismic change right now. It's not our father's healthcare landscape, and we've seen changes here for ourselves, and just a move toward consumerism and wanting information in real time and kind of on demand. We see millennials who are interested in proactively managing their healthcare, boomers who are interested in health from in a reactive way to addressing healthcare needs and healthcare challenges as they age. And those different challenges and access points to healthcare offer great challenges for us as healthcare communicators and professionals in a variety of ways, and particularly those of us who do this on a daily basis. And we're finding our biggest challenge and best opportunity is to kind of meet people where they are, be that at home, at work, at school, or out and about. And our panelists today are going to talk about this. And we're going to talk about health from the standpoint of mind, body, and spirit. All of those things contribute to our overall health in a holistic way. And we're going to talk about that. And we're also going to see examples of work that are high tech, low tech, and in some instances, no technology at all, reaching people where they are. And some are high touch and some are low touch. Let me start by introducing our panel, and then I'm going to let them go through each of their respective examples of the great work that they're doing. And then I'm going to ask them a few questions, and I'm going to open it up to the audience after that and allow you to ask your questions, because we want to hear from all of you and have this be a great conversation. Right next to me, I have David Mays, who's a communications director from Kaiser Permanente. And sitting next to him is Carla Parker, all the way here from Boston with Athena Health. I have Seema Wadhwa from Virginia, who is with Innova Health, and Lisa Waters, who's with Edelman Public Relations, and she is an EVP in the healthcare practice. And I have Matt Paxton, who is joining us from the show Hoarders, and he has a business called Clean Clutters. And so we're going to hear from all of these folks today, and I'm going to kick it off with David Mays.
Excellent. We have one of the highest technology healthcare systems in the country, but I'm not able to load the slides that I was going to show you. So, but then again, we also have Lotus Notes to deal with as a mail system in our organization. So we have a fantastic connected electronic health system. We have 10 million members within Kaiser Permanente in 7 regions of the country. By far, the largest number of our members are here in California. We're also in 6 other regions across the country. Our history goes back 70 years to the shipyards of Richmond, California, where the industrialist Henry Kaiser needed someone to provide health care for the tens of thousands of men and women who came to work in the shipyards. And he hired a young brash doctor by the name of Sidney Garfield, who had this idea that if you prepaid for your health care, it was a nickel a pay period for the employees who worked in the shipyards. He could then provide for your total health, the health of your mind, your body, and your spirit. And that was completely based on prevention. And we have taken that model just beyond what he ever imagined, providing very preventative services. We actually track exercise as a vital sign. When you come to visit one of our facilities, you're weighed, you're measured, your BMI is charted, your blood pressure is checked. You're asked if you smoke. You're asked if you drink alcohol, and if so, how much. And then you're asked, how much do you exercise? And that's actually charted in your electronic medical record. We know that inactivity, that a poor diet, that any use of tobacco and excessive use of alcohol is behind the conditions that account for fully 80% of what we spend in this country in healthcare, which is about $2 trillion, 18% of our GDP, more than any other country. And so we've really come up with this concept of total health, which we define as a state of complete physical, mental, and social well-being for all people. And that's our members, that's our employees, that's their families, and that's communities we serve as well. Because we know that in the whole spectrum of your well-being and your health, only about 10% of that comes from medical care, and a good 40% comes from personal behaviors. So we have developed this concept, this aspiration, where we want to feed your mind, feed your body, and feed your soul. And we do that through prevention and a focus on total health. And we really have come up with a concept. Our tagline is Thrive. We want our members to thrive, and we want them to be at the very center of their healthcare. And we advertise that. We advertise that they will be able to proactively take care of their health in a connected system, where our 38 hospitals that we own, our 600 medical office buildings are all available to them. We own our own pharmacies, our own imaging equipment. Our physicians are on salary. It does not behoove us at all to have people come and utilize the services. And so we focus on their complete total well-being. And basically, that's what I'm passionate about. I'm a lifelong distance runner. I've been concerned with nutrition and wellness all my life. And now I'm a communications professional within the organization, supporting our C-suite executives at the highest level, including our CEO and chairman, who served for 12 years, George Halverson, who felt that walking was the absolute best way for most people to be able to find activity in their lives. Low cost of entry, easy to do, 30 minutes a day, 5 days a week plays significant roles in reducing morbidities and sickness. And so we are about wellness, and we are advertising that in the form of Thrive. So thank you.
Thank you, David. Carla, please.
Perfect. I'm Carla Parker. I'm the Director of Client Performance at Athena Health, which is a practice management, EHR, and care coordination solution for providers and medical systems. And so I'm thrilled to be here. I'm thrilled to be going right after David, because total health is what I'm going to share with you all is sort of a piece of that total health. And one of the efforts that we have been incredibly focused on is, I don't know if this, sorry, we'll get the slides in a second, is harnessing the use of the patient portal to build better patient engagement. And so imagine, if you will, a quote that I can't remember it exactly, but if patient engagement were a drug, it would be the blockbuster drug of the century. And the reason why I find that quote to be so powerful is there have been a number of studies that show that increased patient engagement. If you can go to slide 2. Maybe. Number of studies have shown that the more engaged a patient is in their healthcare, the more improved outcomes will be. And so what I mean by improved outcomes, fewer hospitalizations, improved overall health, and lower costs of care. And so, just again, unengaged patients are makes sense, more likely to not take that, not go and have that lab order that the doctor requested, or not make that follow-up appointment that they needed. And so that's what eventually leads to 3 times those unengaged patients with unmet medical needs. Next slide, please. And so when I say patient engagement, what does that mean exactly? So patient engagement is just the collaboration of patients with their providers. And so that is communicating health plans, reviewing their medical records, lab work, all of those sort of items that seem very common sense that you talk about with your provider, but majority of the time you're reviewing those things when you're in the office with the doctor. And so what we believe, and what many believe, is that a way to improve patient engagement, if you want to hit enter, please, is to do that through improved access through a patient portal. And so here is a little bit of data behind the curtain. So what you can see here is that portal adoption is kind of an uphill battle with doctors. There's a lot of hesitation, at least within our client base, to give patients access to their medical records online, schedule appointments online, or pay your bill online, all of those things that you do with so many other businesses online. It's a little slower to get there in the healthcare space. And so we are really enabling and encouraging providers to increase portal access to patients as a way to drive engagement. Go ahead to the next slide. And so this is just some data around how many of us want access. 84% of us want access to our health records, not really surprising. And there's also a large percentage of us that will actually leave our doctor if we don't actually get the access that we're looking for. And so that is a really important point for our providers to understand, that this is not only about improving your patient's outcome and overall health, but maintaining your business. And go on to the next slide. And these are all, again, really basic things to do, but you'll see here some numbers around what people are actually saying they would do if they had access to a patient portal. You'd schedule your appointments, you'd get your lab results, you'd pay your bill. And so it's a lot of this work today in many of our practices is done in a one-on-one conversation. You're calling the office, or you're, like I said, you're in the office with your doctor. And so what business wouldn't want to have all of this available to their patients or client base online? And so what we are doing is really trying to engage our providers and our practices through many of the solutions on the next slide, but specifically the patient portal, to really draw patients in and keep them connected to their care, so that we'll eventually reduce those hospitalization rates, improve their overall health, and keep them connected. And so these are just some examples, but my focus today was specifically on portal adoption, but there's a number of other interesting things that are happening around population health and direct outreach to patients with reminders for annual wellness visits and flu vaccines and all of that good stuff. So I'm really excited to be here, and thank you all for coming to join and listen.
Thank you so much, Carla. Seema, tell us what you're doing with your employees.
Great.
We'd love to hear about that.
We're going to find out if we have slides or if we will be the panel that is. All right. So we will be known as the panel that had slide technology issues. So my name is Seema Wadwa. I'm very excited to be here today. I'm the Assistant Vice President of Sustainability and Wellness for Inova Health System. For those of you who don't know Inova, Inova is a 5-hospital health system based in the DC metro area. We have about 200 offsite clinics and about 16,000 employees. So as a starting point, the focus of my work has traditionally been on environmental sustainability and engagement with that, and has grown now to look at wellness, our employer or coworker wellness programming. And it really is quite a natural transition at looking at the different elements of health. So I'm going to pause for a second and talk a little bit about healthcare and wellness for the employee health population in healthcare. So most of the time, most people, when they think of healthcare, they think of clinicians and they think of healthfulness and all of the elements that go into that. But unfortunately, when it comes to those caregivers who are providing those services and the care to us, to our community, to our patients, it really takes a toll on their personal health. Healthcare workers are, by industry, the unhealthiest work group. It is very interesting because, you think if you take a step back, understanding what are elements of health, that's something that comes natural for that population. But to truly actually take that time and incorporate that into your own lifestyle, it gets to be a challenging. When you think of a hospital, it's a 24/7 operation. And, when you think of hospital food, there's most people have a gut reaction of, awful, pasty cafeteria food. And a lot of that is changing. So, understanding that we have 16,000 employees. The healthcare employees we have are a population onto itself. And being a healthcare organization, we would like to lead by example by having not only healthy employees, but the healthiest employees in our community, and to be able to translate that action into reality for the rest of our community as well. And the way that we have built our program is really built on 3 dimensions of health. That includes get active, eat well, and healthy mind. And we've really started to build a different level of programming around all of those areas. Our coworker health program is incentivized by a reduction in benefits for the employee in the range of up to $1,000. So there is a significant financial upside to being engaged in your health. And the process really starts with an employee understanding what their own health looks like. And this is where technology has really made a big difference. So this last year was the first year that we incorporated blood screenings as part of our employee health profile as a prerequisite to be part of our program. And, the traditional labs that people get at home to see their own, to see the lab results are not very user-friendly unless you have a medical background. And so, we've partnered with a lab that has really simplified understanding your numbers in truly a color-coded scale of being green, yellow, or red for a number of indicators, whether that is your cholesterol levels. And, I see a reaction of, really, it should just be that simple. And, it's unfortunate that that hasn't been done. I do think that the healthcare industry has been somewhat slow in adapting some of these technologies, as you indicated as well. In addition to that, we have also used technologies new technologies as engagement platforms. So we've partnered with a company called ShapeUp, and we have been able to introduce or integrate into that platform not only our ideology with the different elements of health and ways to get points through that, but also the ability to track and to measure how you're doing, whether that's through your steps or whether that's through calorie counting, but also made it really easy with integrating technology such as wearables into that. And we recently ran a challenge, a company-wide challenge, and we'll be running 4 of those with significant engagement, in the order of 3,000 employees that stayed active to about the 70% mark over an 8-week period, which for engagement is actually quite successful. And, so we're really seeing how we're able to use these technologies to engage and educate and supplement that through building programming, whether that is offering cooking classes to our employees or offering seminars that are focused on that healthy mind element of what we're doing. So, we really look forward to continuing on our health journey, but also discovering new and innovative ways to engage and interact technology into changing our culture of health. Thank you.
I have a lot of questions for you.
Go for it, please.
No, I'll wait. But can I just go ahead?
Yeah.
So I have a question for you in terms of when you're looking at the programming and the success rate of the participation.
Mm-hmm.
I'm fascinated about the kind of the generational divide between the boomers and the boomers and the Xers and the millennials, and participation in terms of how you engage them. And I'm a communicator, and so I'm always looking at how you communicate. And generationally, we fall in very different categories. And with the way technology is now, you see millennials that they embrace the wearables. They want to share all of this information together. Patrice, you had kind of alluded to that in the beginning, but I'm just wondering, with the participation, did you see who participated generationally and how did they participate? And did you see a difference in how they participated?
So we haven't had an opportunity yet. The analysis, the first challenge we just finished and got the preliminary results late last week.
Mm-hmm.
But what I will say in terms of our engagement, we did look at the demographics of who participated in our screenings, and it was very proportional to our population.
Okay.
What's also interesting, I know there's been a lot of focus on women's health in many of the panels today, is hospitals generally have high female populations.
Mm-hmm.
We have about 80% of our employees are females. So, just to your point of how are we communicating and what are we communicating and making sure we're targeting that messaging, that really is something that we're trying to be thoughtful of. We do realize that many times women do play that role of being the health caregiver for their entire family.
Mm-hmm.
And also being more thoughtful sometimes to the health of their children than their own health.
Mm-hmm.
And that's very true. When you're a nurse or a physician or a caregiver, you are caring for somebody, you understand that, but you don't take that time for yourself.
Mm-hmm.
So aligning that messaging with how important your health is to the health of your family is, those are some of the things that we're looking to build into further for our programming.
Very interesting. We're actually working on a campaign right now that kind of speaks to that, where we're developing creative around the tagline right now that we're kind of playing around with and it's geared at women. It's geared at getting women into screening programs.
Mm-hmm.
And what we're saying to them is putting your health last isn't putting your family first. Because that is exactly what they do. They push it all the way down. Women tend to push it all the way down the list, and they think that they're the hero of the family by putting themselves last. And we're trying to get them to kind of say, if you're not around, in a couple of years because you didn't get the screenings that you should have gotten and the preventative care that you should have had, you're not putting your family first. So anyway.
So I'm going to turn it over to Lisa to talk about her wonderful projects and her great work at Edelman. So
yes,
please,
well, no surprise. I'm a communicator. That's what I do for a living. I'm an executive vice president at Edelman. We're a public relations firm. I'm based out here in Los Angeles, and we have a very well-developed healthcare practice. we're the largest independent agency. And so we have lots of different sectors we work in, but health is one of the most built out. And so our clients kind of range between pharmaceutical, biotechnology. We do a lot of managed care work. We do med device work. I personally end up doing a lot of public health work because that tends to be one of my passion areas. We do health IT, but we're always looking at, the clients come to us. There are all these different types of companies, and they all come to us with problems around communicating something that they feel is important. And we're problem solvers, and we're always kind of looking at, okay, who do we have to communicate with, and how are they best going to receive that information? And, sometimes there's tweaking, and sometimes we have to use different messengers. Like sometimes we have to go through the media to tell stories, and you got to figure out how to do that, visually, creatively. You have to do that, in sound bites. Sometimes we're teaching physicians how to communicate with other physicians to talk about data, which is really hard because that's taking the complex and making it simple, especially when they're teaching others. And then we also do a lot of consumer-facing accounts, consumer-facing work when it comes to public health issues. And, that because that is my passion area, I'm always looking at, we look at Edelman right now, we're actually looking at health and wellness and what wellness means. And we're studying wellness to find out what different generations feel wellness entails. And there are big generational differences between what wellness entails. And what we've recently learned is that, and I don't know if this is going to come as a surprise to many people, but I think it helps us kind of reframe how we deliver messages. But boomers and Xers tend to look at their physicians and think of wellness as in health, as in physical health. Whereas the millennials are looking at it more holistically. They tend to look at things like, or they tend to feel like wellness, it includes financial health, mental health. Your guys are way ahead of the curve at Kaiser Permanente because of the way you think about it holistically. But it's definitely more encompassing. And then in terms of what we do with that information, you have to reach folks you have to talk to folks using messages through messengers that are going to resonate with your target demographic. So right now I'm working with a health technology company, and what they want to do is take basically do wellness, but make it more of a insert gamification into wellness to get people to play games with each other. It's really I think it's a much more millennial play because they're looking at making health and wellness fun. And also competitive. And when you talk about like the contests and the employee contests, that it really resonates with some of the work we're doing. And they're actually we just launched using a celebrity this week. Kevin Hart is going to be the spokesperson for the brand, and we're sponsoring his comedy tour. And one of the reasons why he was selected is because he's got a really big millennial following, and he's a huge fitness buff. And so when we're talking about communicating with our target demographic, we want to make sure that whoever we're using to communicate is the face of the folks we're trying to communicate with. So his audience is our audience, and we want to make sure that those marry up. And so we've launched a program with him, and there was a kind of a big splash in People magazine this week about his participation in the program. And we've done a lot. We've done a little bit of a celebrity tour with him. We're going to go on the road with him to do his comedy tour. It's a very different way of looking at healthcare and getting folks that you wouldn't automatically connect with healthcare to talk to their followers. I mean, he's got a very developed social media profile. All companies are looking at, how are we going to do better here? And I will tell you, health companies in general tend to lag in that area because they tend to be way more risk averse. Mm-hmm. And so when our clients come to us, we've been trying to push digital. We push digital, and the healthcare companies are so conservative and with good reason. I mean, they've got major concerns that they're worried, big HIPAA regulations and concerns that they're worried about. But if you get the right client, if you find the right client that you can really push the envelope with, you can develop programming that is kind of next generation programming, which is really what I'm excited to work on at Edelman. I mean, we're doing things that you don't normally put gamification, like folks playing games with others online and health challenges online. You don't normally think that, and we're like giving them coins and tokens to do it. And like, it's you know, how do we incentivize a generation that is used to living there, you know? So I'm trying to learn as much about these millennials as I possibly can so that I can best market to them, because it vexes me. But anyway, that's a little bit about what we're doing at Edelman. Mhm.
Thank you, Lisa.
Yep.
And now we're going to turn to something totally different. We're going to take on TV here, and we're going to hear from Matt Paxton.
Thank you. She mentioned we're going to go from high tech to low tech, and I am the low tech. I clean the messiest homes in the country. I happen to do it on TV. But what we really deal is this TV show that I'm on called Hoarders, we put someone else's mental disorder on TV for entertainment. And that sounds awful when you phrase it that way. But that's what we do. And what it's turned out to do is we are reaching, it's funny, mind, body, and spirit. All of my clients are at a low point of mind, body, and spirit. And they're lost. And they do turn to technology. They turn to TV for socialization. They turn to TV to find out they're not alone. The TV show I was on, I mean, I cleaned houses for 3 years before I got on TV. I was just trying to make rent, basically trying to get beer money. And I cleaned houses for not a lot of money. And they put us on TV. And I didn't know that there was all these hoarders all over the country. I didn't even know what it was called. In fact, my mom brought to attention, I wrote a letter to the governor of Virginia when I first started my business trying to start a hoarding task force. And I misspelt the word hoarding. I spelled it Hording. It was so long ago, we didn't even know how to spell the word. Just kind of embarrassing to think about it. But we get on TV, and immediately, I mean, the next morning, I had 500 emails, people saying, hey, I need help. And no one knew that there were millions and millions and millions of people that hoard. We now know it's between 10 and 14 million, which is 5% of the country. That means one of you in this room will eventually be a hoarder. I know who it is. You know what I'm talking about. It's an alarming thing. I mean, you know, I'm kidding. It's an alarm that the math on it's just amazing. And, you know, we did it for so long before we did it. And then what happened was the people came on TV and they found, oh my gosh, I'm not alone. And then what did they do next? And so they went online. They started to find other people that were having the same problem. And this amazing website called Children of Hoarders popped up. And it's still run. It's an amazing website, still run by a bunch of volunteers that found out they weren't alone. And it's now they have all these Facebook groups. They have all these, I mean, God, Instagram is amazing with hoarding. They've had this group where they try to find the most beautiful thing in a hoard. And every week they try to take the most beautiful picture, and it's actually turned into art. It's pretty fascinating. And one guy has now become a pretty good, well-known artist, one of our former clients, finding the beauty in a mess, in the hoard. It's amazing. But technology has brought them through. For us, at the beginning, it was just all about awareness. And I had a small company, me and 4 ex-cons. We would travel the country just cleaning whatever house anybody would pay us to clean. Then we get on TV, and we were having to turn away about 400 families a week. Which, think about what this is people at the lowest form of mind, body, and spirit. Wonderful people, but they're at a very low part in their life. And they reach out to us, finally, some of them took 5-10 years to get the courage to ask for help. And then we said, hey, sorry, man, we're busy. We'll get back to you next year. We'll put you on a waiting list. And they would never come back for help. And so we had to use technology on the business side to grow my business so we could help people. Fast forward, 7 years later now, I run the nation's largest hoarding cleanup program with a company called Service Master Restore. We were purchased by them. We have 57 locations. We'll have 100 by the end of next year. Trying to find a way to affordably provide compassionate help to hoarders all around the country. But 10 years ago, no one knew what it was. And so it's pretty cool to see, at the beginning, we were using technology for awareness and education. And now it's more focused on solution. I mean, someone asked me in the panel last night, how are you using devices to help hoarders? And I hadn't really thought about it, but a majority of our middle America clients, they can't get quality therapy where they are. And so now we hand them tablets and they get therapy from a really good OCD specialist in Chicago, or they get really good therapy from the specific person that deals with their grief in Atlanta. And they get it for $100 an hour, whereas before they never would have touched it. And then you see all these groups coming together. That is probably my favorite thing in the world. There's a convention now for hoarders that get together and they talk about solutions. And It's a wild party, I'll tell you, on Monday night. And they're just amazing people that you find them at their lowest point. And I think I was telling you all, I mean, like, my biggest issue this summer is I have too many weddings of former clients to go to. These are people that were literally defecating in their living room and throwing their diapers on the floor and had 100+ cats in their house. And now they want me to come meet their boyfriend, which is an awesome thing to see. You asked me to talk about the business side of this. I mean, what's amazing to me is, you know, I didn't have Facebook. I had an email. That was it when we started. And now, I mean, we have to be everywhere. It might take someone 10 years to reach out for help with this disorder, but we have to be available at that exact minute because they may never reach out again. And so we have to have 24-hour helpline, live answer with someone that's knowledgeable. All right. We have to be in every article. If you search it, I better be the first guy that pops up. I got to be on all the videos that pop up on YouTube. You said just now, you said, weren't you on a TV this morning on a commercial when I was running? Damn right I was. And I better be every time anyone thinks about it. I mean, that's my job. I got to be on the shows. I got to be on the commercials. We got to have products. We got to have books. I mean, speeches, you name it. If someone reaches out for our topic, we have to own it physically and digitally. And it's amazing to me how quick that happens if you interact with your customer base. For me, I tried to own it myself and tried to control it, and I failed. When I let go of it and let my customers and my fans run with it, it's gone very well. I mean, I did a thing that I went to a curling event. I was giving a class to insurance adjusters. The guy had it at a curling facility, the sport where you scrub the ice. And I put a picture out there of me curling the stone. And I learned, I said, put it out there on Facebook. I said, guys, have fun with this. Send me some cool pictures back. And within an hour, people were posting pictures of me like throwing cats down the ice and all things from the show. But the technology extends the show. I mean, my busiest day is the day after the show. Show airs on Monday night. I live tweet and live Facebook during the show. And we always get 2 or 3 jobs the next day because someone has interacted with us. The technology, if you use it, is amazing. The problem is it's got to be constant. Mm-hmm. I think they're a great example of the masses. I mean, we're one of the smallest companies out there. We were. I mean, and now to think that, you know, we are the one central place people go, and it's because of technology. It's because of the awareness that we got out there. But it took 10 years to grow it. You know, I think it's just at the end of the day. I'm on a TV show, but that's just one of the 20 things we do. We're talent, but really we're out trying to help people. And TV is just another way for us to show the world we're there to help them.
Thank you. Thank you all. I mean, just really, really great comments and so forth. I have a few questions I'm going to throw at you, but I want, if anybody in the audience has questions, please feel free. And maybe I should start with the audience if there are any audience questions. Please.
Yeah. I'd like to ask, you're all communicators, so I'd like to start with a central question that you started with earlier. Talk about engagement. Let's look at threshold engagement. You're talking about portals. We're talking about health campaigns. A lot of the population, especially with portals, I have contrary research on the topic of attraction to portals. How do we get the consumer, how do we get the person on the street to a portal, to a health portal? Because we find in the medical field, and even whether it's on the hospital level or at the physician's office level, getting people to change the culture, the mentality. In the past, you didn't go. Nobody's making appointments online except some of the millennials, but nobody's even asking their physicians for their records. How do we engage on the face-to-face ground level? How do we engage your clients, our clients, with a campaign or a portal? Same idea.
Anybody want to take that?
I'm happy to take that. You know, I think that the root of a lot of that is just how we value health and healthcare. And I think with the new model of health and health reimbursements, the Affordable Care Act, the incentive is now financially tied more to prevention. And so historically, where it was fee for service, it's now fee for value. So the healthcare industry and all of the other distribution elements that tie into it have a financial model that will help them make those connections more rapidly. I also think that there's a few other ways I think that can happen. I think employers can also start to play more of a role in supporting their employee health. And I think that's true from large to small organizations.
You misunderstood my question. I'm talking about on a granular ground level. How do you engage a patient? How do you engage a citizen in a healthcare campaign? This event is about strategies, particularly digital strategies. So I guess, but I don't even care if they're digital or not.
I'll stab at this. For us, my product is a product nobody wants at all. We really struggled. We didn't have it. Nobody wants to talk about a disorder. So we actually went to another industry. We actually went to pastors, and I said, nobody's going to church right now. How do you get people to come to church? And they were like, man, that's an amazing question. We don't know. We're stuck too. And so we started getting therapists and ministers, very regional, very local. But at the end of the day, in the inner city of the church, they paid the guys $20 to show up at church. It was an incentive. And guess what? It worked.
Yeah. I was
People
just
showed
gonna,
up.
I was just going to say that when I was talking about my client Rally Health, we're trying to incentivize folks to go on the online portal. It's basically an online portal. It's available to folks who are insured by certain insurers. But we know that unless they're incentivized to go and that they like what they see when they get there and that makes sense to them, they're not going to go. And so when I talk about the gamification, that's giving people something for hanging out there. Chits. So he's absolutely right. Like people are too busy. And so you have to incentivize, whether it's for discounts. Like it's not gonna, I know we have to take some survey, and if you take a survey, you get money knocked off the top of whatever your premium is. Yeah, there's absolutely that. And then, but once you get them there, you have to make sure that whatever that content is there is going to resonate with the audience you want to keep there. So it has to be clean and fresh. It has to be easy to navigate. It has to look like what everything else looks like that they're playing with. If they're and useful. If they're gamers, it has to look like a game. It has to be authentic.
I can speak to the patient population at Kaiser Permanente. We have a saying within Kaiser Permanente that was developed by our Care Management Institute, which focuses on quality care and finding the best practices in care throughout the country. Make the right thing easy to do. And so we have designed a portal that's incredibly easy to use, where you can secure email your physician. You can send photos of yourself to your physician, and you'll receive a response from your physician usually within the same day. You can refill prescriptions online and have them shipped to your home. You receive your test results as soon as they're available at the same time that your physician receives your test results. And at Kaiser Permanente, our workforce of 200,000 people, including 17,000 physicians and 50,000 nurses, they're also our members and our patients. And so when they have contact with our members in the clinics, they talk about the portal. They talk about how easy it is to use. And as a result of that portal, as a result of the high touch, easy contact that our patients have with their caregivers, we've been able to control hypertension by 87% among our patient population. And once people are on the portal, and about half of our members are now, they tell their friends and their neighbors.
How do you get them to the portal?
So one of the strategies that practices on Athena Health that are the most committed to leveraging the portal require it. Every new patient, you sign your registration form and you sign up for the portal. The number one bill that we pay in the US is what? Your cell phone. everyone's walking around with a mobile device that if you have a portal available and it's available on your iPhone or your Galaxy or whatever, then, I would look at my lab results on my phone. I would schedule my appointment. I will basically do anything online to not have to pick up the phone and call a real person. So, it's the engagement at the patient level. 50% of the time when we get, or 70% of the time when a front desk person actually collects a mobile phone number from a patient and signs them up, they sign them up for the portal 70% of the time. So as long as they're asking, and they're asking in a good way, this is not, when you're checking out at a store and they want your email address so they can send you a bunch of spam in your inbox. This is, do you want online access to your health record? Do you want to be able to schedule your appointment online? Of course I do.
And if the portal makes your life easier, you may not have to come in for a visit. We have secure e-visits, and much can be done online or even through a telepresence or a telephone call with our caregivers. I have not seen my physician in the past 3 years, but I've had at least a dozen secure emails with her, and we've been able to do everything that I need. Yes, I have to come in to have my blood physically drawn because that's just required right now. And there may be a day where you're able to draw your own blood and ship it in as well. But that's about the only time I've had to come into the office in the past 3 years. It just makes their lives easier. And so that's what we've really stressed is putting the consumer first, finding ways to make, again, the right thing easy to do and to take that stress out of there. Who wants to drive, across town, take time off from work and have an office visit when you can do it securely over email?
Thank you. Next question.
Yes, for Seema. You mentioned that you had an unhealthy workforce. How do you measure that unhealthiness? And is it BMI? And how do you account for ROI? How do you measure ROI then?
Great. I'm going to actually comment on the first part of the question. And the question was, we mentioned that healthcare has an unhealthy workforce. How do you measure that they are unhealthy, and how do you measure the return on investment of this program? So the first thing I'm going to highlight is just the incredible value in understanding people's perception of health versus their actual health. So when we do our blood draws, we have a full panel we look at. There is not only the BMI portion, but we also look at LDL, HDL, a full comprehensive, very comprehensive panel, and A1C to look at actual true health indicators from that perspective. Now, one of the things that I wanted to share was we also did what's called a health risk assessment, which is the online questionnaire, at the same time to ask people what they thought their health was. And then we compared that to what their numbers showed. So we had 68% of our population that said they were in, these are the numbers off the top of my head without my slides, but I think, 68% thought that they were in good to excellent health, yet only 8% reported that they exercised at least 2 days a week. It was also really staggering, although I can't remember the exact numbers, the number of people that did not indicate any issues related to diabetes versus the population. I think it was more than 50% showed risk of acquiring diabetes. So in terms of the ROI, if we can target and highlight opportunities to engage those, what we'll call higher risk health indicators, and if we're able to even make a 1% difference on our health insurance claim, right there, the ROI is well worth it. So, we stratify our data, again, using technology to figure out which population within our population really needs that extra help. And we also have health coaches as part of our team. Lifestyle coaches, registered dietitians, etc. And we also are building and programming that we offer to our community as well, our population health services, to help them target the health needs they have.
Great, thank you. I'll take the question in the back.
So I think it's a great panel. It's great, lots of good stuff here. So I'd like to see more people here for the right reasons. So my first question will initiate with Lisa, because Lisa is very great to press the point of saying some things I thought are really good about not people in the industry not really getting this situation and understanding how to really put PR and advertising and marketing social media. They have the conservative mentality, and I think everybody understands that, right? In the panel, do you agree? I'm assuming that has to rely on really insurance, okay, risk, all that stuff. So my question would be, if you understand that, if all you understand that, and Matt, you understand it, but you were thrown into it, which kind of brings it out to the forefront. How do you break down the bureaucracy and all the BS that goes on with this? Because it doesn't mean anything. Everybody knows that the healthcare systems have got problems. So the question is, how are you going to use the social media intelligence, the understanding that Matt understands? What are you going to do to really knock some doors down and kick some butt? And I mean that sincerely. I mean, without disrupting the big, big brother mentality of financial profits and all that stuff, because whether we like it or not, paradigm shift began with the problem.
Yeah, it's a great question.
Television is not the only area. They're like,
I appreciate what you said.
Yeah. I appreciate that.
Television is the least placement to do that. The issue for me is I'm a smaller business. There's a lot less commas and a lot less zeros. So it's easier for me to try to make change. I got a lot less to lose. I can try some things on social media. I did a college tour. I went out and got drunk with kids every night. It was very effective on social media. My insurance was not very excited about that when she saw it online. I mean, at the end of the day, and I heard them all saying it, we do come back to, I'm seeing in the economy in general, doing the right thing is starting to actually be profitable.
Yeah.
And that sounds crazy to say that, but it's, obviously I'm assuming Kaiser doesn't do it because they lose money. You guys obviously make money and you're doing the right thing. And we're seeing that at micro levels and macro levels, and I think you'll see more of that. Go ahead.
Yeah, I was going to say I think that we are, because at Edelman we deal with a lot of different types of clients, right? So we have and one of our strongest practices is tech. And they're way out there. And I was just at a meeting with a bunch of our leadership, and they were doing case studies on all the really cool things they're doing digitally. And of course, all of us in health are kind of sitting there going, but we tried to sell that in and they couldn't. And so I absolutely hear what you're saying, because the risk is so large. But I think if we look at digital and technology and go, okay, look at disruptive technology, like, Amazon.com and customer service, and how easy it is to access. It's so easy. They deliver it to your door. You were talking about blood draws. There are companies, I've pitched them, that will actually come to your house and take your blood. How do we look at ways where healthcare can be disrupted in a way that we're looking at technology companies as leading, and look at all the ways that we've got like entrepreneurs who are out there inventing things that are going to push a very conservative, very bureaucratic community forward. And they might go a little kicking and screaming, but they're going, because that's where their customers are, and they've got to keep up. And as consumerism in health continues to evolve, they have access to their own dollars. Like your employer in the future isn't going to say, pick from these are your 3 different healthcare plans. They're going to say, you could very well have a pot of money. You go choose which healthcare plans, not we are going to provide these 2 healthcare plans. Look at the exchange. Yeah. You go to Cover California, you have a choice, and they have ratings, and they're going to have to be accountable. Hospitals have to be accountable. Mm-hmm. They have to say the way hospitals are judged now are different than it was, 5, 10, 15 years ago. They're asking patients about their patient experience. That's disruptive. That's going to change healthcare. So the more we're looking at how technology is pushing things forward in other areas, that stuff is trickling into healthcare. We're on the tail. Yeah. We're just the tail, but it's happening. And there's pressure to do it. I mean, there's a company up north that's looking at, they want to be the Yelp for healthcare, you know, and they want you to say, okay, I didn't like that doctor. That doctor made me wait 15 minutes. I don't want to wait 15 minutes. You know, like you go to a restaurant and you go, you know, I don't want to go there because it's too expensive and the lighting's dark and they treated my sister badly. It's the same thing that's going to happen when it comes to getting access to care. You're going to have complete transparency. That's what's happening right now. That's what we're all talking about. We're all kind of on the forefront of that shift towards transparency. And when you have that transparency, you're going to make a different decision because you're not going to be told where you have to go. You're going to get to choose where you're going because you're going to have the dollars to spend. They're going to give you the dollars and you're going to decide how you're going to spend your money.
And that is part of putting the consumer at the center of healthcare.
Yeah.
And you know, I mean, I think whether being on the forefront or the lagging end, the healthcare industry has to change because the competition is no longer the hospital down the road. It's the Walmart, it's the Walgreens, and it's a CVS where you can get your, you know, you can get in and out and get your healthcare taken care of. So health systems now need to remodel how they are providing their health because their competition is not who it used to be.
Which is why we have pilot projects in Target stores now. Kaiser Permanente has mini clinics in Target stores where people can get the health care where they live and where they work and where it's convenient.
And I think to Lisa's comment about Yelp, I have seen so many physicians really react to seeing people comment about them on Yelp.
reviews. Yep.
And those Yelp reviews really change their mind about, oh my God, I got to make sure that I'm doing this better or differently because now people who aren't a part of my practice who might choose me as a physician now know what others perceive of me. And so it is very much a game changer. Other questions?
As we work on the mental health side, we're about 10 years behind, and we had to hire a lot of lobbyists, to be honest, to get our voice heard. And it worked. Hoarding is now a part of the DSM-5, and it's now recognized as its own mental health disorder. And that's provided for funding and research, and it's advanced our group. But if a couple therapists had not put their money together and hired a lobbyist, never would have happened. Probably 5 people are really responsible. 5 therapists are responsible for changing the face of hoarding.
Go ahead.
Where would you put billing in terms of importance for transparency?
Oh, you mean cost? Like transparency of cost?
Cost and billing.
I think that's I mean when I'm talking about that company up north that I'm thinking, and I won't name the name because they're not a current client of ours, but I would like them to be. But the part of their business model is, I'm going to tell you what the Yelp reviews are for your doctor. I'm going to tell you how much a hip replacement would cost if you had treatment from that doctor in that hospital versus if you had treatment from that doctor in that hospital. Transparency in billing is going to be enormous. I mean,
It's already starting.
Yeah.
And we now have a brand new service where our members can go online and plug in their member ID number, the procedure that they're thinking about having, and know exactly what they're going to be able to pay based on what plan they purchased in terms of copays. And they can do that right now in real time.
I mean, it's really confusing. I mean, it's very confusing. I was making a choice on what healthcare coverage am I going to pay for, the PPO or the PPO plus, and you know, I had a child last year, and I was, you know, like, there's big considerations because I knew I was gonna have probably the biggest medical costs I had my entire life. I've been really healthy and very lucky. And it's really hard to read with your employer when your employer gives you're like, I'm like, okay, how many visits do I get for that? And is it worth it to pay the extra $200? It's tough. People are gonna, health insurers, and you know, the way that they present consumers with information is shifting now. And there's going to be a huge demand for it because patients will have the power.
And if I could just add one last thing.
Sure.
Healthcare organizations are also now getting into the insurance business, and that is also going to significantly change the model when, you know, it's their dollars that they don't want to spend. So just another consideration.
That's Kaiser.
Right.
That's Kaiser, and they're one-
We have a health plan, and then we also provide the services. So we're basically an insurer and a health delivery system combined, vertically integrated.
And that's something Inova has also done recently,
Right.
and more systems are going to that.
And I'm gonna have to make that our last comment because we're totally out of time.
Wow,
But all
really?
of us, I know we went through so quickly. All of us are going to stick around, and we are more than willing to talk with you and answer any questions that you have. And thank you so much for joining us at